Hello, I'm Steve Swensen. I'm the Medical Director for Professionalism and Peer Support at Intermountain Healthcare, and I serve as a Senior Fellow at the Institute for Healthcare Improvement, co-leading their Joy in Work effort. Today I'm with Taylor Davis with the KLAS Arch Collaborative, and we're going to be talking about professional burnout in healthcare and what that means for providers, and other caregivers, but most importantly, what it means for patients.
We're learning more and more in medicine as we move forward about the importance of not just treating the body, but the whole emotional and the whole being of patients and those who come into healthcare. And frankly, as you speak about that, a hospital or healthcare system without love is a very lonely place. Right. And we're learning that loneliness is dangerous. It's not only doesn't help healing, but it's actually dangerous to healing. And so how do we create inviting environments where a team can be a team and everyone is focused on creating a great holistic experience for these patients? So
the research that we've done and the experience we have with now over tens of thousands of healthcare professionals in different organizations, one of the tactics is to do just that, is to build camaraderie. Because we know it makes a difference to combat burnout and brings joy in work. And one of the tactics there is a fancy word called commensality. Commensality is a word that means sharing a meal together. And so the original research was done with firefighters who eat a lot of meals together, make a lot of meals together. And basically, commensality improves team dynamics, team performance, and camaraderie and outcomes. And at Mayo Clinic, there's some physician leaders that ran 2 randomized control trials with doctors in commensality, and guess what? It improved all the dynamics of professional burnout in the doctors that had a meal together and talked about something in their lives, patients and mentors and coaches and good cases, and it decreased emotional exhaustion, decreased social isolation, increased positive feelings about the organization. So this camaraderie, whether it's over a meal or not, is one of those human needs that if we lose that in any parts of our lives, and our work life is the biggest part of our life, then we're vulnerable to bad things, including professional burnout.
And it's interesting how you say that, the importance of having a team environment. Healthcare is moving much more towards a team. And one of the areas that has created significant stress for healthcare providers and clinicians has been moving from a paper chart to an electronic chart. I think of these almost as 2 different sports. You have a solo sport with a paper chart, and you have a team sport with an electronic chart. And right now we're watching in the Olympics, we're watching a number of team sports and a number of solo sports, and there's a very different mentality as to how you approach those. Yeah.